I'd also like to bring in this topic of IBS, irritable bowel syndrome, is something a lot of, and I don't like saying this, but it's something a lot of girls around me are facing. Few guys, for sure, but I primarily see this with a lot of Indian girls, especially. I don't know if that's a worldwide thing where it's more girls who are affected by this, but every girl I know, at least in media, maybe it's because of the scrutiny in media, in terms of you have to always look good on camera, etc., etc. It definitely spoils your sense of peace. Bringing in one angle of spiritual stuff here, your Hara chakra, which is the second lowest chakra, is kind of supposed to be at the same position as your gut. And they say that when your peace is shaken up in life, that your Hara chakra gets shaken up, but it's also synonymous usually with IBS. So there's a lot of gut related treatments you can do for IBS. But I know for a fact, and I've spoken to gut doctors about this, usually with a lot of IBS patients, if you're able to fix their mental health very deeply through therapy, through other means, the IBS issues get fixed as well. What I'm trying to say here is that your long-term happiness is probably linked to your gut. Now, you're the MD doctor. I'd love for you to make this conversation even more scientific, and you can tie in the chakra stuff, whatever you wish.
Yeah. I'm so glad you brought that up. I would say more than 50% of the people I see in my practice are for gut health, for IBS.
Really?
Yes. And it's not something I expected when I started out. But what happens is Western medicine is very limited with IBS. You know, you go to a GI doctor, they might do colonoscopy, some tests, they will say, you don't have cancer, you're fine, just eat more fiber and come back to me in 6 months, right? That's all you got. There's actually a study that came out that said people with IBS are willing to give up 10 to 20 years of their life just to feel better. Imagine asking someone who's in their 30s, they're suffering so much that they would rather give up 10, 20 years of their life just to feel better right now.
What's the reality of the IBS feeling on the inside? Like, what does it feel like?
It is disruptive to the entire life. I've had patients who have broken up in relationships, who've quit jobs, who have gone into depression, anxiety because of their symptoms. So IBS stands for irritable bowel syndrome. So it's sort of a basket of different types of symptoms because everyone has a little different flavor of it. So the main thing include things like gas, bloating, stomach pain, diarrhea, constipation. So basically every time you eat, you're getting these symptoms. So on a daily basis, you're suffering.
Okay. And what's the mind feeling like?
If something interrupted your life every single day and you did not know how your day was going to go, think about how annoying but stressful that would be. You're going to a party, you're meeting up with friends, you don't know if your stomach is going to hurt. You don't know if you might have to run to the bathroom, right? So imagine you are someone young, living up your life, and something like this affects every aspect of your social, personal, professional life. So IBS can lead to, it's like a chicken and egg thing. It can lead to more anxiety, more ADHD, more depression, because you're sort of losing control of your life. That's how it feels like.
Okay. So if an IBS patient comes up to you, what is the treatment you give them as an integrative medicine doctor? I'm sure there's like an angle of Western medicine mixed with something Eastern, right?
Yes.
And I'd love for you to explain the logic behind both as well.
So with IBS, just like any other condition, Western medicine is very good at acute symptoms. It loves to put a Band-Aid on something, right? So if I say I have constipation, okay, take this pill to help your constipation, right? So we look at everything in isolation. Eastern medicine takes a step back and says, what is the root cause? Where is this coming from? So that's the reason why it's so important to ask for, what is your diet like? Is it because you have, poor diet? That's what's triggering. What is your sleep level like? Is poor sleep affecting your gut? What is your mental health like? What's the level of stress you're experiencing? Any anxiety issues? What's actually going on in your life? So this is how I'm able to connect dots and find that root cause. Because with IBS, if you just put a Band-Aid over it, it doesn't work. It really doesn't. Maybe it'll help you for a month. You're going to come right back. So my goal is to take the time to understand the root cause, because if we address the root cause, we're not only just going to make IBS better, so many other conditions will get better too.
Yeah. At least from an urban Indian perspective, I think every family has one family member at least who's suffering from IBS.
Yes.
So a lot of people might watch this podcast feeling great in their stomach and thinking that, hey, this doesn't apply to me. I promise you it's going to apply to someone around you. It's a very important conversation.
Yeah, and the reason why it's not getting that much attention, because no one talks about it. We're all shy. We don't want to talk about our bowel movements and gas, right? We're shy away from it.
I think it's because of the term leaky gut.
Yes.
It just sounds poopy.
Yes.
If there was a nicer sounding word for it, I think people would talk more openly about IBS.
IBS, yes. And not just it, the first step is recognizing it. You know what's crazy thing I often hear from my patients? Because we don't talk about this enough, people don't even know what normal is. They're just so used to this. They're like, wait, not everyone goes through this? Like, so sometimes I ask patients, especially men, men are often not as connected to their bodies as women are, right? So often when part of my history, when I'm meeting someone, I ask them everything about their poop, whether they like it or not. So I often ask them, tell me about your bowel movements. And most men will say, oh, everything's good, regular, all good. Then I ask, how often do you go to the bathroom? I cannot tell you how many times people have told me that they go to the bathroom once a week, and that's normal for them. So until you actually ask, you don't even know, because people have just normalized it, just part of life. No one has educated them about what normal bowel habits look like. What are you supposed to really feel?
What do normal bowel habits look like?
So at least once a day, 1 to 2 times a day, properly formed stool. It should not be painful. It should not just fall apart. It should be well formed, not too hard, not too soft. And the main thing is regularity, in the sense it should be predictable. You get up in the morning, you go to the bathroom, that's normal. But if you have to sort of run every time, that's not a good sign. So regularity and consistency of the quality of the poop is something you have to pay attention to every day. You got to look in the toilet bowl. That's the only way you're going to know.
Why is that? Like, if you have to run every day, why is it not a good sign? What's it saying about your gut?
So it's saying that something irritated, right? Some inflammation is happening in the gut where your body is just like, oh my God, I have to go. So that urgency is not necessarily a good sign. It can get worse over time. So it's almost like a little bit of a red flag. You want to pay attention to it so that you identify the root cause before it becomes a full-blown disease.
We had a doctor on the show a couple of days ago. He was speaking about stem cell therapy. And he was an orthopedic doctor. And he said that one of the early signs that you need to be careful about when it comes to your bones and muscles are these niggles. So if you're active, if you lift weights or if you dance regularly, you develop these tiny pains in your shoulder and your elbow, whatever. But that's the red flag when it comes to muscles and bones. You're saying that if you have to suddenly run to the toilet and it's probably not at the same time every day, that's a red flag when it comes to your gut health.
Yes. Pay attention to it before it becomes a problem.
Even if your poop is like well formed.
Yeah. If you feel the urgency, like I got to run, I got to go to now, that indicates that some inflammation, some irritation is happening. And you want to get the inflammation in check because, as you know, inflammation is the root cause for so many diseases. So especially in the gut, as you know, that's the first step. That's the first red flag. So that inflammation can easily spread to the rest of the body. So the sooner you address, the better. And that's why people start developing allergies, skin issues, right? A lot of that actually starts in the gut. So pay attention before it becomes a bigger problem.
I can't believe I'm asking you this on the show. So pardon the question. But I watched a reel recently. See, this is the good side of short content that you get to learn like stuff. But they said that if one's farts smell bad, that's also a sign of gut inflammation, and actually farts are not supposed to smell.
Yes, that's another one of those red flags, right? That you will find out very quickly. So, there's actually tests for this. So there's a condition as an extension of IBS that I often encounter. It's called SIBO, small intestinal bowel overgrowth, which basically means that the bacteria in the gut, there's mostly supposed to be in the lower part of your gut, in the colon. They leave that area and start migrating further up in the gut.
Wow.
So that causes much more severe symptoms and produces gases like methane, hydrogen sulfide that can smell bad, cause a lot of inflammation in the gut. There's a really cool device I use in my practice, actually. It's like a little breath analyzer. So after you eat, you breathe into this thing and it will measure how much hydrogen, methane gas you're producing.
Wow.
So we can see the extent of this condition. And as we're treating someone, we can see the progress as well, which is fascinating that we can do that.
So you can tell the composition of your gut bacteria through your breath?
Yes. You can do
Really?
it two different ways. So in my practice, what I sometimes do is I'll order an actual poop test to look at exactly how many of the good bacteria do you have, bad bacteria, any signs of inflammation. Another way to test for this specific condition I mentioned is through a breath test. Because what happens is, as the bacteria in the gut make a lot of this gas, it gets absorbed into our blood, and then we exhale it out through our nose. So that's a simple way of measuring it without having to do any invasive, process. But it's fascinating that we can see this right away. You eat something that doesn't agree with you, you see the number go up. So then you're more mindful, oh, this type of food, every time I eat onions and garlic, I don't feel well. And you can see that in the test result, right? When you're breathing through. So now you eliminate those foods and you see, oh, the numbers are starting to go down, right? So then we can tailor a treatment, a diet plan based on actual data rather than just trial and error.
Okay. And the effect of foods on one's gut could be different for different people,
Yes.
right?
So I'm so glad you asked this because it's one of my favorite quotes in Ayurveda. It says, food that is metabolized or digested, processed properly becomes nutrition and nourishes your body. Food that is not processed properly, not digested, metabolized properly, becomes toxic and root cause of disease. Food is the same, but your body's ability to break it down determines if this food is going to be nutrition or poison.
Gotcha.
Right.
Speaking about this food could become poison angle, we've had a lot of dermatologists on the show. Dr. Rashmi Shetty especially, I've spoken to her in detail about this. When you start breaking out, if you get even like a single big pimple, it's usually a sign of an irritated digestive system. Of course, there could be other factors, but your digestive system shows up on your face. That's what I feel. Now, you said that your breath is also a sign of it, how your mood changes through the day. Maybe that's also a sign of it. And obviously, your poop is like the most detailed sign of your gut bacteria and therefore your gut in general.
Mhm.
Fair to say?
Yes.